In this video, we will talk about the prostatic treatment. Prostatic treatment is basically decided on three factors. Number one is poor flow. Number two is amount of the post-void residual urine on ultrasound. Number three is PSA level. The things which are basically not important in deciding the treatment, they are: number one is on ultrasound the size of the prostate. Number two is nocturia or increased urinary frequency. These two things can be understood by two examples. Like, one patient is coming with the 100-gram prostate with normal flow, no post-void residual urine, normal PSA, but the prostate gram is 100 gram. This patient does not require any treatment basically. Second example is, if the patient is coming with the night frequency, like going for the urine 5 to 6 times with normal flow, normal PVR and normal PSA, that also signifies that patient does not require any prostatic treatment. This nocturia is basically because of some age-related changes in the bladder, not because of the prostate. Now, another thing is important to understand when medical treatment cannot be given in case of prostate. Number one is chronic urine retention. This is basically a silent disease where the urine is staying in the bladder without causing any significant symptoms. On ultrasound, there will be significant PVR, like more than 500 ml. Along with that, back pressure changes in the ureter and the kidney, leading to bilateral hydronephrosis and hydroureter. If the patient ultrasound shows this type of picture where there is a significant amount of the PVR with the bilateral hydronephrosis and hydroureter, there is no point giving the conservative treatment to the patient. We have to tell the patient that this is better to do surgery in this condition. Second option is, there is a bladder stone on ultrasound in old age. In that condition also, it is not good to give the medical treatment. Now, the treatment is divided into two categories. One is medical and another is surgical. In this video, we will talk about medical treatment first. Medical treatment, first we have to understand few basic things about the medical treatment. Number one is, it is a lifelong treatment, because this medical treatment does not cure BPH. It just controls it. Second important thing, there is not any significant side effects. That's why it can be taken with other medicines. There are two types of medicines. One is alpha-1 blockers, another is 5-alpha reductase inhibitors. This alpha-1 blockers are always given, plus minus 5-alpha reductase inhibitor. Now we have to understand that why alpha-1 blocker? Because this alpha-1 receptor is present in the bladder neck. In arteriole and in vein also. Wherever alpha-1 receptor is present, it is causing contraction. In bladder neck, by contraction, it is causing holding the urine in the bladder. By contraction of the arteriole, it increases the total peripheral resistance and thereby increasing the diastolic blood pressure. In vein, by contraction, it increases the venous return. In turn, it will increase the systolic blood pressure. Now, we can see that alpha-1 blocker, by looking all these 3 points, we can understand the benefit of alpha-1 blocker and the side effects also. Alpha-1 blockers are Tamsulosin, Tamsulosin and alfuzosin. In this alfuzosin, there are two side effects of the alpha-1 blocker. Number one is retrograde ejaculation, another is postural hypotension. This retrograde ejaculation is minimum with the alfuzosin and more common with the Tamsulosin and Tamsulosin. And postural hypertension, this is more with the alfuzosin and less with the tamsulosin and silodosin. Among this medicine, silodosin is the most effective medicine. Now we have to understand what is the meaning of postural hypertension and retrograde ejaculation. In postural hypertension, you can understand that alpha-1 receptor is present in the bladder neck and arteriole and vein. By contraction of the arteriole and vein, it is maintaining the blood pressure. But when we are giving the alpha-1 blocker, it is also relaxing the arteriole and vein. By relaxation of the arteriole vein, there will be pooling of the blood in the lower limbs, and that will cause fall in the blood pressure. By fall in the blood pressure, in postural hypertension, that is usually more than 20 millimeter of mercury fall in systolic blood pressure. Because of this, patient feels dizzy when he stands from the lying or sitting posture like this. When he is standing from the sitting posture, there will be some dizziness. And important thing is that this symptom persists only for few days. And after 3 to 4 days, the patient become used to this symptom, and body used to become used to this medicine, and body adapts itself to control the blood pressure. Because of this, there is always a risk of fall. So we have to be careful, and we have to advise to the patient, we have to give advice to the patient that for the initial few days, you have to stand slowly rather than fast, and try to have some support on the wall. Another side effect is retrograde ejaculation. Why retrograde ejaculation? Ejaculation means semen is coming out from the urethra. First semen comes out in the prostatic urethra. Here semen comes out, and from here this semen comes out from the urethra like this. During normal condition, this bladder neck remained closed. That's why this semen does not go into the bladder. This you can imagine. After ejaculation, you have to, if you are going to pass urine after that, then immediately urine doesn't come out. You have to wait for some time so that the bladder neck relaxes, and then urine will start coming down from the urethra. But in cases of alpha-1 blocker, this bladder neck does not close. Because this remain open, that's why this semen in the prostatic urethra will go into the bladder through the opening of the bladder neck. So when patient is taking alpha-1 blocker and do the ejaculation, then this semen will come out with the urine after the ejaculation. And if patient complains of this, that I am not passing the semen after ejaculation, then we have to change the medicine to alfuzosin, because this alfuzosin is having the minimum side effects of retrograde ejaculation. In summary, you can say that in young and sexually active patient, it's better to give alfuzosin. In older and not sexually active patients, it's better to give tamsulosin or silodosin, because these two medicine having the less chances of postural hypertension. Next category of medicine comes 5-alpha reductase inhibitor. 5-alpha reductase inhibitor is basically given along with the alpha-1 blockers, not alone. This medicine is not given alone. And another important thing is, this medicine is given only when the prostate size is more than 30 gram on ultrasound. Example of this medicine is Dutasteride and finasteride. Dutasteride is more potent. This Dutasteride is written like in the marketed name of the medicine, like Urimax D or plus. Finasteride is written like F. Because this 5-alpha reductase, this enzyme causes the conversion of testosterone into the dihydrotestosterone, and dihydrotestosterone is important for the prostatic growth. It decreases the 5-alpha by the giving 5-alpha reductase inhibitor. It will inhibit the conversion of dihydrotestosterone. By decreasing the concentration of dihydrotestosterone, there will be decrease in the growth of the prostate. Along with the decrease in the growth of the prostate, also will have impact on the sexual drive and erection. So, in younger sexually active patient, it's better to avoid it. Thank you.